I'd like to welcome everybody to today's presentation. We're continuing the series on culturally responsive care with people with different sexual preferences. And again, we're talking about preferences in terms of sexual activities and potentially relationship structures, not sexual orientation in these particular presentations that we're going through right now. Today, we're going to be doing an overview of kink. So, the obligatory trigger warning and cautions. The following presentation involves frank discussions of kink and sexuality. While not graphic, some of the content might be triggering for some people. This series is meant to provide an overview to help clinicians understand kink, BDSM, and polyamory, but is by no means meant to be all-inclusive. It's designed to increase awareness of common issues and help clinicians identify areas where they may need further training. So we're going to define kink today, and we're going to learn about the breadth of kink, including but not limited to BDSM. Kink kind of encompasses everything, and BDSM is just a subset. We'll learn about its prevalence, identify the ways a kink-aware therapist can modify assessment paperwork to be more inclusive. We'll learn about the PLISIT model for treatment, explore the application of the Johari window, and review the kink-aware pledge. Kink is a form of playing. It's everything that falls outside the confines of having sex simply to orgasm. So it can take a whole lot of different forms. It can include bondage, fantasy, sensation, toy play, and even furries. And when I say furries, what we're talking about is people who choose to dress up as certain types of animals and role play as if they are, dogs, cats, horses, whatever. Furries are a subculture of kink. If it's not your cup of tea, no worries. There are plenty of other subcultures within the kink arena. The first rule of the kink community is that you lose the right to judge others. When what one person is into may not be your cup of tea, and that's okay. And that's really important when we're talking about kink, because if we're working with one client who is involved with kink-related behaviors, what they do may be totally not on the spectrum for other people that we're working with who are also kink. So we want to respect that. But that's also important when we're working with people who are in relationships and who are engaging in kinky behaviors, because you may have two partners who have very different kink interests. They're both into the kink scene, but very different interests as far as that goes. So there's going to be some talking and negotiation to figure out if they're compatible. In a world where women have long been told sex is just to make babies, addressing what gets you off can be a powerful way to take control of your sexuality. So getting into kink, and a lot of the clients that we work with may have already gotten here, but many of them may have read 50 Shades or something and start deciding, that sounds interesting. I might want to explore that. Or my sex life in my current relationship has really gotten stale. I'm wondering what options are out there. So one of the things that people can do is go through yes, no, maybe lists. And they are pretty extensive lists. We're going to go through some of the stuff in a little while. And people identify whether it's yes, something they'll do, no, something they won't do, hard limit, off the table. Maybe is what we call a soft limit. That means with the right partner, under the right conditions, if we talk about it ahead of time, I might be willing to explore it. And it's important for people to really know where they are with each individual activity and to share that with their partners. So these yes, no, maybe lists are really helpful for opening lines of communication, because a lot of people, when they first start getting into kink, they have no idea what's out there. I mean, they think, bondage and spankings, and that's about all they can think of. When there are literally hundreds of other things that they can be doing. The yes, no, maybe list is also good because many people are reserved or shy about talking about their sexuality and what they like and what they want. So if it's down on paper, it's easier to hand your partner a paper or exchange papers, or sit there and just go down the list together and identify whether it's a yes, no, or maybe as you're going through the list. Encourage people who are trying to get into kink. They think they might be interested. Just because they read about it and learn about it, or even dabble in it a little bit, doesn't mean they have to continue to. They can experiment and decide whether it's for them or not. Encourage them to read. There are lots of books out there. There are lots of really bad books out there, but there are lots of really good books out there. So know if you're going to give bibliotherapy, it's a good idea to preview the books ahead of time to make sure that they are written in a safe, sane, and consensual manner. Websites that feature sex toys can also be a place for people to go and start exploring what's out there and thinking, okay, well, that might be interesting, or no, not going to go there. A mistake a lot of people make is getting the idea that kink and BDSM somehow magically absolves them from having to communicate or figure out what they like. It's just like, okay, I'm going to be the submissive, the dominant will tell me what to do. That's not necessarily it. In these relationships, communication is so important, partly because in these relationships, it involves a power exchange, and both partners at one point or another are probably going to be pushing certain limits and certain boundaries. So when you're pushing boundaries, when you're dabbing your toe outside your comfort zone, it is just vital to have trust. And again, this goes back to the yes, no, maybe list. If you get into a situation with somebody and you're exploring kink and you've never discussed what your hard limits are, what your soft limits are, then your partner can't respect those. If they don't know that that's a hard limit, can't necessarily respect it. And if you're not talking during the act, then again, they can't read your mind. So communication is so important. It's also important because there are a lot of things on a yes, no, maybe list that one partner may think, oh, I never thought you'd be into that. And turns out you are. So again, this opens up the lines of communications. In this brief exploration of kink, there are lots of other things that fall under each letter. I just kind of handpicked some things that tend to be more common. A is for, and you can go to the BDSM wiki, or you can go, there's a website called fetlife.com that you can go that has a much more extensive list. Now, I will warn you, fetlife.com is an adult website and it is pretty graphic. So if that offends you, then that's not a site you want to go to. Anyhow, A is for age play. That's pretty self-explanatory. Pretending you are younger than you are, potentially. And anal play. Again, self-explanatory. B is for bondage, alone or with someone else. And this is where sometimes it can get dangerous with autoerotic asphyxiation, but other forms of bondage as well, tying oneself up in order to increase stretching or flexibility or whatever. There are a lot of reasons people tie themselves up and try to see basically what the sensation is. So reading a lot about bondage will be helpful. Bondage can also include things like handcuffs and blindfolds. It's really big realm of stuff. C is cuckolding, and this may be one that you're not familiar with. It's having sex with someone else to arouse or humiliate your partner. This is consensual non-monogamy, if you will. In cuckolding, the submissive partner has said, either I'm okay with you going out and having sex with somebody else, or it would really turn me on to know that you were going out and having sex with somebody else. And there's a little bit of humiliation and emasculation in there. It can, again, run a pretty big spectrum. Chastity is another C, and there are lots of chastity devices for both males and females. And enforced chastity is when the dominant holds the key or the whatever it is, usually it's a key, to the partner's device that prevents them from being able to access their genital region. Enforced chastity is one where sometimes the dom will let the person take off their chastity device in order to get a release. Sometimes it can be taken to an extreme where chastity is enforced over a really long period of time. It's important to read about the health precautions for any sort of activity in kink, but enforced chastity does also have some precautions with it, because keeping things locked up for too long, that's not how our bodies were really meant to work. Now, I did want to bring up the term CBT. We think of it as cognitive behavioral therapy. In terms of kink, that's not what it means. CBT means cock and ball torture. So if you're working with a client and you're working through issues of kink and you happen to say, I want to do a CBT exercise, and their eyes get really big, that's why. They're not thinking cognitive behavioral therapy. They're thinking the other. D is for dominance, discipline. They can go hand in hand. They don't necessarily go hand in hand, but they usually do. We'll talk about that more on Tuesday. And deep throating. E is for exhibitionism. And in the days of internet and webcams and all that kind of stuff, exhibitionism has become more mainstream, if you will. Back in the day, when I was younger, before computers existed, exhibitionism was more difficult to find willing recipients of it, because people in the kink community are very sensitive to not exposing or offending people in the vanilla community, if you will. So when they engage in exhibitionism, it's with people who want to see it. It's not just to surprise somebody. That's non-consensual. Non-consensual exhibitionism is a no-go. So E is for exhibitionism, and it can take a variety of forms, whether it is group sex or webcam sex, those sorts of things. F is for fetishism. Really broad spectrum here. And it can include worship of certain body parts or certain things, or some sort of humiliation. It can include financial worship, or F is also for financial worship, and furries, like we talked about earlier. G is for gagging or grooming. And grooming is another one that can be used differently by different people. Many times it can mean grooming your partner, like brushing a partner's hair or something, but sometimes it means adhering to certain grooming requirements, like being completely hair-free on your body. H is for humiliation. And yes, I have an entire slide designed to this, designated to this, because I think it is so important that we really understand that this is consensual humiliation. And that is a really hard concept for a lot of us to wrap our heads around. And consensual humiliation, including name calling and verbal abuse, is something that the sub, the non-dominant, has identified as an activity that excites them in some sort of way. To humiliate someone is to assert power over him or her by denying and destroying their status claims. Sometimes people who in the vanilla world, in the public world, who are type A alpha personalities, really like to be taken down a notch when they are in private. So that can be one reason that people engage in this. And that's not an uncommon theme when you're working with people who enjoy humiliation. When we talk about hazing rituals, even to help you understand why or how humiliation can be consensual, for example, hazing rituals that a lot of fraternities put their people through, even though they're not supposed to haze, they do, involve a fair amount of humiliation. And that is something that somebody participates in consensually. During this humiliation experience, the sub has to find the strength and self-esteem to come to terms with his or her humiliation. So it's incumbent upon them to separate from the experience or rise above the experience, however they envision it, in order to feel the euphoria they're working towards. Erotic humiliation is the consensual psychological humiliation performed in order to produce erotic excitement or sexual arousal. This erotic humiliation can be either for the person being humiliated, they want to do that because it gets them off, or for the dominant, because the sub knows that being abusive turns the dominant on. It's a choice, and it's a choice that both have agreed to and both can call off at any point in time. It's important that we recognize that most people in the kink community, you're always going to have a couple people that push limits, are very respectful of people in the vanilla setting, such as restaurants or supermarkets or things, and will not engage in the humiliation behavior of their partner in public, in a vanilla sort of setting. Back to the alphabet. I is for impact play, and this incorporates anything from hands to paddles to whips to hairbrushes and anything else you can think of. Anything that creates an impact between the sub and something else. It can be the dom or some object. J is for Japanese bondage or shibari, and it's the art of binding someone. Some people find the experience of being bound, and especially being artfully bound, to be exceptionally erotic. Some people enjoy being bound and then having pictures taken because the shibari is almost like macrame. It is very intense and very intricate binding that can take place. This can be very erotic for a lot of people. It's not just about tying somebody to a bedpost or something. Bondage can serve a whole lot of different functions. K is for klismophilia, which is pleasure from enemas. L is for limits, hard and soft. We talked about hard limits before. That's when somebody says, no, that is not something I will ever do under any circumstances, not my thing. That's okay. Soft limits can be something that people say, if the moon is blue on the third Thursday of the month, I might consider it. Okay, well, when we get to the third Thursday in the month, we might cross that bridge. In kink and BDSM and everything we're talking about in this series, it is essential for the dom, well, for both parties actually, to respect and recognize each other's hard and soft limits. A dom is going to try to push a sub in their soft limits to try to get them more comfortable with things, try to get them to experience and dip their toe out of their comfort zone with consent, of course. If a dom is pushing a sub against their hard limits, if they're disregarding hard limits, that's abusive. If they are pushing soft limits hard enough and not staying attuned to their sub, and the sub starts to have an unhealthy, unhelpful, unpleasant reaction, then that can also cause damage. The dom is really in charge of making sure that whatever goes down, and everybody is okay with it in the scene. M is for can't speak today. M is for masochism, which means deriving pleasure from pain. Some people really enjoy the rush. Think about, when you first think about it, you're like, I can't imagine getting pleasure from pain. Think about clients that you've worked with who have been engaged in non-suicidal self-injury. Do they get pleasure from it? Not necessarily. It may distract them from their internal experience, but it also can provide an endorphin rush. There are other things that we do where we get pleasure from pain. I go to the gym and I work out till I lift until failure, and it hurts like a bugger and a half. But when I'm finished, I'm like, oh my gosh, I never thought I could do that. So there is some pleasure that can come from pushing ourselves through a pain sort of scenario. N is for needles. Some people like to play with them. That's not my thing. You know, I'm terrified of needles. I didn't even have an epidural with my children because I was so afraid of needles, but it works for some people. So understanding that needle play is something that people may do, making sure that they do it in a safe way to prevent the transmission of any sort of bloodborne pathogens. N also stands for non-suicidal self-injuring. We're going to talk about this more in BDSM, I believe, if we don't get to it today. In the kink form of non-suicidal self-injury, there's actually a positive anticipation and a sense of relief and euphoria after the self-injury, as opposed to people who engage in self-injurious behaviors who might be suicidal, who are dreading the pain. They're not looking forward to it. They're doing that in order to escape a greater pain. In kink, it is something that they look forward to greatly and experience pleasure afterwards. Outdoor sex, orgasm denial, and obedience training, all pretty self-explanatory, are in the O's. P is for pregnancy. Some people really enjoy the look of a pregnant woman and the changes that happen in her body when she's pregnant. Q is for curophilia, or a hand fetish, or queening. And R is for role play. Role play can do, and a lot of people, whether they identify themselves as being in the kink world or not, engage in occasional role play in their sexual encounters. So that's not something unusual to hear of. Now, the types of role plays that people engage in, that's another area that people need to have very open, frank discussions about. What is okay to role play and what is not okay to role play? What might be triggering to one of the partners? Queening is taking a male and having them dress up in female lingerie, and even though they wouldn't normally wear that for any particular reason. That's not something that they necessarily like doing. It's a form of humiliation. S is for submission. We've talked about that. And scat play. And scat is feces. Some people enjoy playing with scat. T is for teacher or student. And, you know, there are a lot of fantasies about that. Or talking dirty, or threesomes. U is for urophilia, otherwise known as water sports, which in a lot of situations goes along with scat play because water sports involve some form of urine or other bodily fluid. Making sure that people who are practicing with scat or water sports are practicing good practices to prevent any sort of transmission of bloodborne pathogens is important. V is for voyeurism. Again, consensual. Some people enjoy watching other people have sex. So you have your exhibitionists who enjoy performing. You have your voyeurs who enjoy watching. It's a match made in heaven. And vinyl. There are leather. I didn't mention that under L. Some people are very into leather. Some people are more into vinyl. There are a lot of vinyl suits that you can get. If you think of, Catwoman. You know, Catwoman had that sort of head to toe vinyl suit. W can stand for whips or wax play. And Z is for zappers, which is just what you think it is. It's electrical stimulation. It's not as bad as getting tased, but they do have wands out there that will provide an electrical shock. Like I said, this only incorporates about a 20th of the different things that are out there in kink. And some of them that I didn't mention, you may think, oh, that sounds interesting. Some of them that I did mention, you may not think work for you. That's okay. It's knowing what's out there and not being surprised or having this look of horror when your client tells you about what they've been doing in their relationships. Polydynamic relationships in BDSM, they do exist. It's one of those things, and I probably could have put that in BDSM, but we'll talk about it here. In BDSM, sometimes alternate relationship structures are referred to as families or polyservice. Not everybody in a polydynamic relationship is in the relationship for sex. Sometimes it is a service-oriented activity or service-oriented relationship. When you have a master, a dominant, or a daddy or mommy, they may be in charge of multiple slaves, submissives, or littles. We're going to talk about that a lot more in the BDSM segment. These relationships may or may not have a sexual component to them, and the focus is on how the submissive can contribute to the resources and needs of the dominant partner in order to ensure that the dominant partner is getting their goals achieved. Okay, so we are going to talk about non-suicidal self-injury today. When you're working with a client who engages in non-suicidal self-injury, some of the questions that you can ask them include, what are your expectations or motivations for engaging in intense sensation play? And that's generally what it's referred to. What kinds of thoughts and feelings do you typically experience prior to intense sensation play? Now, when we think about intense sensation play, you want to remember that we're not just talking about cutting. It can be needles, it can be cutting, it can be impact. There are a variety of different things that fall under this umbrella where someone can experience self-injury, but they have no suicidal ideation. What kinds of thoughts and feelings do you typically experience during intense sensation play? And what types of thoughts and feelings do you typically experience after intense sensation play? It's important to help the client process through these to make sure that NSSI for them is a positive experience they're engaging in and not something else. It's important to recognize or ask about how intense sensation play affects how people feel in relation to others. Does it make them feel like they're odd? Does it make them feel just fine? How does it make them feel? And how does intense sensation play affect how you feel about yourself? Even if they are not suicidal, some people who engage in non-suicidal, self-injurious behaviors may feel shame because they feel that it is odd. They feel that they would be judged for what they're doing, and they fear getting committed to a mental health facility or something because of their behaviors, because of wanting to push their limits. Dr. Aaron did a bunch of studies with this, and he found that individuals that struggled with NSSI experienced overwhelming negative feeling states prior to self-injury. These are the people who are not doing it as part of kink. They had overwhelming negative states prior to self-injury, then felt a wave of relief and distraction during or immediately after the self-injury, which was followed by deep regret and shame afterwards. This is what we typically see in our practice when we're working with someone who exhibits borderline type behaviors, those sorts of things. The BDSM group, however, stated that they felt excitement and anticipation ahead of time, a sense of excitement and pleasure during the encounter where the injury was taking place, and a wave of deep connection to their partner afterwards, as well as a stronger sense of self-empowerment and authenticity. So this can include not just somebody self-injuring themselves, but it can include a partner providing intense sensation play, which could lead to injury. The key difference is they felt a stronger sense of self-empowerment and authenticity afterwards versus the people who were not engaging in NSSI for kink-related reasons. Let's talk about changing the assessment. And we're regularly changing our assessment as we become more aware of all the things that we potentially have been othering in the past. And othering is a sense of dismissing or minimizing or shaming a group that is not like you. We don't want to have the married, divorced, single, widowed questions. Sometimes you can't avoid that because the state requires it. However, if you can get away from it, it's ideal. When you're talking with people about their relationships, instead of saying, tell me about your husband or tell me about your wife, tell me about your romantic relationships. Because we don't even know if they're in a monogamous relationship. They may be engaging in consensual non-monogamy. Tell me about your partners, plural. What struggles do you face in your love life? Have you had any sexual partners? Are you in a relationship? And a relationship, remember, in polyamory, everybody is in a relationship. It's not like they're in 5 different relationships. And who's in that relationship? If they say one person, fine. If they rattle off a list of people, that's fine too. Do you have sex with men, women, or both? Do you or your partner have sexual or romantic relationships with anyone else? And let me go back to, do you have sex with men, women, or both? This is getting away from having somebody identify necessarily pigeonholing them into a particular sexual orientation. We're just interested in who they're having sex with. Do you or your partner have sexual or romantic relationships with anyone else? And are you and your partner monogamous? Those are all questions. Some of them are a little bit redundant that you can choose to add to your assessment to be a little bit more inclusive. Many people, as we talked about in the last session, are not going to openly disclose to their clinician that they're in a polyamorous relationship or that they engage in BDSM or kink type behaviors. If we proactively approach it and put it out there so they realize that it's okay, then we are going to start opening that channel and destigmatizing what they're going through. Other questions that we want to ask: is the kink involvement impairing the client's health, happiness, or ability to function independently? Most times in the assessment, we're going to draw that from other questions, but this is what we need to understand. Kink behaviors can be fully consented to and empowering and all this kind of stuff, or somebody can feel pressured into it, or it can be harming them in some way or another. Financial worship, for example, that's a perfect example. Some people enjoy spending or giving another person a whole lot of money so they can achieve their goals. That makes them happy. It doesn't harm their functioning at all because they got more money than they know what to do with. Does it make them happy? Does it impair their health? Does it impair their ability to function independently? If the answer is no, then okay, that's a personal choice. If, however, you see someone who is spending their every last red cent to financially worship someone and they are having difficulty paying their bills and it's causing them stress, that's something else. So we would want to look at what the function of that relationship is in their life. Are the therapist's perspectives and value systems being used to make a negative judgment about the client's BDSM or kink involvement? It's important for us to know what our values are. If a client tells us something that may be one of our hard limits, but it's not for them, do we judge them unfairly? Do we make sweeping generalizations based on what we were taught in college? Are all parties involved in the relationship adults and capable of providing consent? Yes, that's so important to make sure that exists. The participants have a clear and realistic understanding of the intended and potentially unintended short and long-term impact of the kink or BDSM activity. Obviously, if people aren't engaging in kink, then you don't need to be going through these questions with them. If they are, then it's important that we know that they're thinking about it, they're understanding the impact of it on them, and that everybody involved is involved consensually. We want to make sure that our clients are not being abused in any way. Is the client willing to accept all of the potential outcomes of engaging in the activity or relationship? And that can be kink, BDSM, poly, whatever structure they're looking at, are they willing to accept any or all of the consequences that go along with that? If you're working with a client who is identified as interested in kink behaviors or engaging in kink behaviors, and I'm just going to say kink from now on, what is your understand? We want to ask them more questions to make sure that they have a good understanding of what kink is, why they're doing it, how it impacts them. When people come to treatment who are engaging in kink-related behaviors, it doesn't mean they're in treatment because of those behaviors. Those behaviors could be ancillary. If I go to the doctor because I'm sick, it doesn't mean I'm sick because I went out and I ran 10 miles in the rain necessarily. My sickness could be completely due to something else. We don't want to lump them all together. So if somebody has indicated an interest in kink, or if they're engaging in kink-related behaviors, we want to ask them, what is your understanding about consensual poly, kink, or BDSM? Obviously, you choose the term that is appropriate for that particular client. Have you discussed issues about consent with your partners? This goes back to that early slide that indicated that a lot of times, not always, but a lot of times people get into these relationships and they assume that means they don't have to talk. They can just be. And that is one of the worst things to do in a kink-oriented relationship. We need to make sure that consent has been discussed, as well as hard limits and what do you do if you're starting to feel uncomfortable. Ask them how they define consent in their practice. So how do you define consent in your scenes or in your relationships? Do changes made within relationship dynamics involve the active consent of all partners, regardless of dominant submissive status? A dominant may have multiple submissives. So if a change is made in the relationship dynamics, for example, one submissive is dismissed, did everybody have active consent in that activity, or did the dominant make the decision? Can you, the client, choose to leave the relationship? And if so, what supports and barriers exist? So if this client is in a BDSM relationship, if they're a sub, this generally happens more with subs than doms. If you're a sub in a relationship, can you leave? And if the answer is no, then our red flags go way up. If they believe they can leave, then the question is, if you wanted to leave, would you have supports available? Would you have somewhere to go? What would you do? And what barriers might exist to you leaving, such as finances, children, all of the things that we normally consider when we talk with people about leaving a relationship. Does the dominant demonstrate a responsible approach to those under his or her authority? Dominants have to be aware. They have to be cognizant of everybody's limits, and they have to be respectful of those limits. The dominant has to be aware during a scene. Again, I'm going to say it multiple times. If a sub starts having an unexpected reaction or is not doing well for some reason, the dominant has to be able to call the scene off. It's up to the dominant to know how much and how far, just in case the sub does not feel like they can, or they're not choosing to use their safe word. Do you feel respected and valued as a result of engaging in BDSM, kink, or poly? Some people love the lifestyle. If they do, great. As long as you feel respected and valued, cool by me. How does this help you fulfill your personal needs, wants, and desires? What does this do for you? Maybe it keeps the sex interesting. Maybe it helps people feel empowered. Maybe it helps them push themselves, push their limits, just like somebody who tries to climb Mount Everest. People have a lot of reasons. And do you feel a sense of expansion or liberation as a result of engaging in the activities. If it helps people feel like they're growing, like they're expanding their view, their vision, their mind, their whatever, cool. This is what we want in counseling. We want people to live authentically and be in touch with what their needs are, what their wants and desires are, and be able to live a life that is rich and meaningful to them. So if this works for them, then okay, just questions that we're going to go through and ask. Other questions that are useful for us to keep in mind. How aware is the client of their own boundaries, limits, and needs? Some clients have very weak boundaries. They may be codependent. They may have a lot of relationship trauma or attachment trauma that can contribute to people not being aware of their own boundaries and limits or willing to set and hold them. What do you know of what the client is doing to make sure that their practice is safe, sane, and consensual? If the client says, I just show up and I do whatever I'm told, if you're told to do something that makes you uncomfortable, how are you able to get out of it or stop the scene or whatever? We want to make sure that clients feel empowered. Is the behavior experienced as nourishing or diminishing? What does it do for the client? What might this behavior release a client from? Some people, like I mentioned earlier, are type A alpha people in the public world. And when they come home, they don't want to be type A alpha anymore. They want to be submissive. They don't want to have to really think about much except for doing what they know is expected of them, or engaging in behaviors that encourage them to examine some of their weaknesses. That's cool. What's the function of the behavior? Does the client realize the function of the behavior? Is the client limited to or associated with specific practices? Is client discomfort limited to or associated with specific practices, scenes, or words? Like I said earlier, role plays, there's hundreds of thousands of role plays you could do. Some people are not going to be comfortable with certain particular role plays or scenes, or they may not be comfortable with certain words. You can call me this, but you can't call me that. Or you can refer to parts of my anatomy by this, but not that. That's all part of the discussion. If certain things make a client uncomfortable, and in the kink realm, most people have something that makes them uncomfortable, that's okay. Encouraging them to be aware of that, maybe understand why it makes them uncomfortable, and decide whether it's a soft or hard limit for them and how they're going to communicate that to their partners. What does the client enjoy or value within their alternative relationship or practice? And when we as therapists are thinking about voicing concerns, we need to think first about which part of what we heard doesn't feel okay to us, and what are the ramifications for the client. Like I said earlier, it may not feel okay to you, it may not sound okay to you, but it's empowering and liberating for the client. So what do we need to say, if anything at all, in that situation? Cultural countertransference is another issue that comes up for clinicians when working with the kink community. Cultural countertransference was coined by Perez Foster in 1998 to describe the countertransference feelings experienced by therapists who serve culturally diverse populations. In the practice of BDSM, emotions and behaviors that are normally considered unhealthy, undesirable, and include things that bring on a sense of shame, powerlessness, etc. All of these things are eroticized. Cultural countertransference, as it applies to kinky clients and their sexuality professionals, means that professionals have to confront our own mainstream value system, theoretical beliefs and practice orientation, subjective biases, and feelings about various aspects of BDSM, even in our own sexuality. we need to figure out, why are we having this reaction? If we're having a strong negative reaction or even a strong positive reaction, we need to know where that's coming from in order to know, can we effectively serve this client? Most of the time, the answer is yes. There are a few cases where it may not be. And we need to be aware, again, of the different practices. So it is important, if you're going to be a kink-aware therapist, you need to be aware of the different activities people may be engaging in, because certain activities may go against your value system. And you need to figure out how you feel about that and how you're going to handle it if and when a client brings that to you and says, this is what we do on the weekends. 5 common psychotherapeutic issues with individuals who practice BDSM or kink. Coming out, being outed, disclosing, however you want to say it, because being involved in kink is often seen as odd, weird, or shameful by certain aspects of the community. A lot of people don't want their business being known. A lot of people are afraid to disclose to their healthcare providers for fear of legal or healthcare ramifications. Many people struggle with guilt and shame associated with some of the kink behaviors, because that's not what we were, when we were knee-high to a grasshopper, that's generally not what we were introduced to. So they may struggle with these issues of being different and maybe being weird or wrong. Some aspects of the culture will tell people that they are wrong for engaging in these behaviors. So we need to help individual clients work through their feelings about that. Even clients who engage in kink-related behaviors may have some internalized kinkophobia, for lack of a better word. They may be afraid of kink, but drawn to it at the same time. That's okay. Helping them come to terms and understand their feelings about kink and what they want to do and where the phobia is coming from and all that is an important therapeutic issue. Some people struggle with depression and anxiety because they feel different, because of isolation. Sometimes, and we're going to talk about this more in the next class on BDSM, the activities and the scenes that are being played out can be so intense that they can trigger hormonal changes that may lead to temporary states of depression. If somebody's engaging in the kink-related activities and they feel shameful about it, they may have feelings of anxiety about people finding out. There's a lot of things that can trigger anxiety as a result of the BDSM practice. Now, remember, you also have people who engage in kink and BDSM who have issues surrounding guilt and shame, depression and anxiety, isolation, that have absolutely nothing to do with their sexual practices. So we want to figure out where the depression and anxiety may be coming from. Common relationship issues with people who practice BDSM include mixed orientation relationships and mismatched sexual interests. Sometimes in BDSM relationships, the dominant may be heterosexual and may have subs that are not heterosexual. Understanding what each person needs and how each person fits into the relationship is important. Now, a dom-sub relationship, a dom with multiple subs, is different sometimes than a polyamorous relationship. You can have a polyamorous BDSM relationship, but not all polyamorous relationships involve BDSM at all. So I need to start drawing Venn diagrams for all this. Othering describes the reductive action of labeling a person and someone who belongs to a subordinate social category defined as an other. The practice of othering is the exclusion of persons who do not fit the norm of the social group, which a lot of us view as the version of ourself. So if they're not like me, then they are othered. We need to be aware of our practices, our behaviors, our microaggressions, and how that might other people who engage in kinky behaviors. We need to be aware, even if you're in the kink community, you need to be aware of all of those things, because there are going to be people, again, who don't do the same things that you do, who have very different hard and soft limits. We don't want to other them. We're all part of the community. It's just, you are who you are. Therapists must be aware of our own kinkophobia, heteronormative beliefs, and identify the ways in which we may other people who engage in atypical sexual behaviors or who have a different sexual orientation than we do. The process of acceptance or disclosure, and I use the term acceptance and disclosure because it is different than coming out, but in some ways it goes through a similar process. Stage 1 is self-discovery of having non-traditional sexual interests. A lot of times this happens, according to the research, before the age of 25. Stage 2, people start disclosing to others. Generally, they're not going around telling their best friend and their mom and their pastor and all those people. They are starting to disclose to other intimate partners about their interests. Stage 3 is immersing or socializing with others in the kink community, starting to go to meetups and those sorts of things. Stage 4 is developing a positive self-identification, recognizing who you are and embracing that and being kink and proud. And stage 5 is integration and acceptance of everything. When we're working with clients, we can use the PLISIT model in order to help them explore some of their sexual interests, especially clients who aren't fully immersed in the lifestyle. They're interested, but they're not sure. The first, the P, stands for permission to comfortably talk about interests and explore personal comfort levels and concerns. LI stands for limited information. We want to make sure that clients have access to accurate, specific, and relevant information. Going back to the fact that there are a lot of really good books out there, a lot of really bad books, really good websites, really bad websites. We need, if we're going to refer somebody to explore, we want to make sure that they are exploring safe, sane, consensual, useful websites. SS stands for provide specific suggestions for homework assignments in line with the client's interests and values and relationship agreements with other partners. For example, if they're interested in exploring alternate relationship structures or interested in exploring kink with their current partner or partners, having everybody in the relationship do a yes, no, maybe checklist to learn more about specific practices of interest. That's not getting into sex therapy. That's just encouraging communication and encouraging people to explore. Intensive therapy, often referred to a sex therapist, helps clients explore interests in sexual identity and decide how best to proceed. Most of us don't have the in-depth knowledge of all the kink practices and everything to be able to feel comfortable and effective working on intensive therapy in this area with a client. We want to foster support and trust with each client by recognizing areas of compatibility and differences. We will have compatibility and differences with our clients, and clients are going to have compatibility and differences with their significant others. And it's important for them to figure out how to, in their relationships, also recognize areas of compatibility and differences and say, okay, we're compatible on this area. This area, it's a hard limit for you. I'm curious. That's a difference. It just is what it is. It's not good or bad. It just is what it is. You can use a Johari window kind of approach where you start out with the open self, the information about you that both you and others know. So this is what the public knows. This is what's out there. And maybe to a certain extent, what a small subset of people know if somebody has started to disclose their sexuality. Now, if they've already disclosed their sexuality, sexual preferences, then that would go under the open self. If we're working on this, they probably have some of that in one of these other quadrants. So what does everybody know about you? The blind self is information about you that you don't know, but others do. This would be things that we, the therapist, may be seeing. We may be seeing some psychodynamic stuff coming out, or we may not. We may learn in a couples session information from the partner that the client didn't really recognize. And they're like, oh, you know what? I never thought of it that way. That makes sense. So we can start talking about the blind self. The hidden self is information about you that you don't know. Information about you that you know, but others don't. And this is generally what we're working with when clients are starting to explore the idea of disclosing or embracing their kink side. So this is stuff they know about themselves, but they're not ready to put out there yet. And we want to talk with them about, what do these things, why do they interest you? What do they bring to your life? And what are you concerned about if people find out, yada, yada. And then the fourth quadrant is the unknown self, information about you that neither you nor others know. This is stuff that will come out in therapy that the client never really realized and we didn't know about ahead of time, and maybe the client's partner didn't know about. It's something, one of those epiphany moments. But we can help people start working towards self-awareness by being aware of their open self, communicating with others to learn more about themselves and take the blinders off, and developing a sense of self-confidence, authenticity, and awareness so they don't feel like they have to have a hidden self, and more of this stuff can move towards the open window. So the Kink Aware Pledge, really quick. People who are kink aware therapists, and there are entire training programs on becoming kink aware. And it's really important, if you're not in the community, that you involve yourself in pretty extensive training on kink stuff before necessarily trying to treat someone who engages in alternative sexual behaviors. Does that mean that if you've got a client who's engaging in kink, you can't work with them? No, not at all. It means that you should be aware that you may need some supervision in order to work with this client. So the Kink Aware Pledge, I won't assume that the issue you're seeking help with is caused by or related to your kink or poly orientation. I won't make assumptions about your treatment goals, particularly these goals including changing your sexual desires. If the client doesn't want to be kink anymore, we can explore that. If the client is very happy with their kink or curious about their kink, I'm not going to try to change them and say you need to go to a heterosexual mononormative relationship. That's not what we do. I won't try to cure you of BDSM, kink, or poly desires, because it's not a sickness. It's an alternative interest or an alternative relationship structure. I will be aware that any distress you have about your kink or poly identity may be a normal part of internalized cultural bias against your sexual orientation or choices rather than evidence of a disorder. I will help you locate and get support from community resources. And the kink community is very large. I will be sensitive to whether and how your kink or poly identity affects your work, social, and family relationships. We don't want to assume that these identities are negatively impacting a person in their public life. I will not assume abuse when you are in a BDSM relationship. I will not assume you are cheating or tolerating cheating if you bring up other partners. I will not assume that BDSM interests means that you're also not interested in vanilla sexual behaviors. Some people like BDSM occasionally, but not all the time. We want to help them figure out how to negotiate that. If you've experienced abuse within a BDSM relationship, I can help you to process and understand that. I can help you to navigate the terms of poly relationships and negotiate agreements that best serve you and your partners and identify and honor everyone's needs. I will remain aware of my own issues and how they may enter into therapy, and will consult with colleagues who are knowledgeable about alt-sex behavior if you bring in issues that are outside of my knowledge base or boundaries of competence. Meetup sites. FetLife, like I mentioned before, is one of the more popular ones. However, once you get into the site, it does have a lot of graphic advertisements and pictures and stuff. So if that is something that offends you, you don't want to go there. Poly Matchmaker, Kinked In, and are other sites where people can meet up online. A munch is a plainclothes gathering where people with different sexual interests meet and mingle. You can find different munches on Meetup, but you can also find a lot of different munches on FetLife. That's probably the best place to find local munches. This is a good place where people who are interested or curious can go and meet other people in the lifestyle. It normalizes it. They can get some questions answered, but they're not thinking, well, do I need to dress in leather, or what do we wear to these things? What happens? It's lunch, like you would go to lunch with any friend. There is a database of kink-aware professionals that you can refer to, you can get supervision from, or you can join if you become a kink-aware professional, or you are. A majority of adults experiment with kink-related behaviors in their lifetime. It's important for therapists to understand the range of behaviors which might occur and be sensitive to the needs of those with alternate sexual lifestyles. Therapists are advised to do significant reflection on their own attitudes and values about sex, as well as the variety of sexual behaviors. Think to yourself, with each of those things that people might do in kink, would you do it? And if you wouldn't, do you feel there's something wrong or harmful with it? If so, what is wrong or harmful, and why do you think it is wrong or harmful? Really work through those biases that you've got. There are many books out there on becoming kink-aware, on becoming a kink-aware therapist and kink-related behaviors. I encourage you to explore some of those. Even if you're not planning on becoming a kink-aware therapist, you will be working with clients who engage in kink-related behaviors, whether you know it or not. So it is always good to be aware so you can feel more comfortable when the topic comes up, if it comes up, and hopefully you can feel more comfortable broaching the topic if you think it might be something that needs to be discussed. Are there any questions? Okie dokie. Well, everybody have an amazing weekend, and I will see you Tuesday.